Though recognizing implicit bias is important, hospitals must have an action plan to address it. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly with AHA Communications. In this podcast, Priya Bathija, Vice President of AHA Strategic Initiatives, is joined by Dr. Zsakeba Henderson, Senior Vice President and Interim Chief Medical and Health Officer with March of Dimes, to discuss why we must educate and train healthcare professionals, nursing, and medical students about implicit bias, but also begin to stimulate action.
Thank you, Dr. Henderson, for speaking with me today. Over the last couple of years, March of Dimes has offered its implicit bias training to healthcare professionals all over the country. And March of Dimes recently updated the training and its title to Awareness to Action, Dismantling Bias in Maternal and Infant Healthcare. Can you share some background on the training and some of the updates you've made to the training program?
Thank you so much for the opportunity to talk to you about our Awareness to Action Dismantling Bias in Maternal and Infant Healthcare training. So, this training is an opportunity to not only increase awareness and understanding among healthcare professionals and nursing and medical students, but also to stimulate action to address implicit bias in maternity care settings. These actions can result in improved patient and provider communication, to improve the patient experience and quality of care, and also to lead to a culture shift across committed organizations towards a broader goal of achieving equity in maternity health care. And March of Dimes has enhanced our implicit bias training for providers and medical and nursing students to uncover institutionalized racism in the healthcare system while also training healthcare workers to dismantle the cycles of this discrimination. So we have two versions of our training program. There is a live training version, and we also have an e-learning module. And the live trainings are tailored for each organization and geography. For example, if the organization is a hospital or public health organization, and also tailored to state or city where they're located. And we can also offer customized action plans and evaluation following the training. And our easily accessible e-learning is a great option because it's highly scalable and it makes it easy to track learner participation and completion of the training. And a simulation bundle can also be added to the e-learning module for medical and nursing students. And this add-on includes simulations that integrate real-life scenarios with debriefing topics and key learning points to engage students in critical thinking and courageous conversations in a safe learning environment. The live training, the other option that we have and we offer, accounts for 3.5 continuing medical education and continuing nursing education credits. And then our e-learning training provides 1.5 continuing education credits. Our training program has been offered to more than 35,000 providers in 30 states and in Washington, D.C. since 2020. And March of Dimes, as you well know, was a recipient of the American Hospital Association's 2020 Award of Honor for our efforts to advance health equity through implicit bias training for healthcare professionals in maternal and infant healthcare settings.
Thank you, Dr. Henderson. And yes, we were so proud to honor March of Dimes for the work that you are doing in this space with our 2020 Award of Honor. You know, I understand from talking with your team at March of Dimes that this new version of the tool has some features that the old version did not. Can you describe some of those?
Yes, I can. We're so excited about the new features of this training. We have learned so much from our partner organizations and from those that have completed the program. And we listened to their feedback for more than a year. And based on that feedback, continuous enhancements have been made to enable us to meet the specific needs of these individuals and organizations and to deliver a high quality training offering. And the enhanced training includes refreshed learning objectives. We wanted to make sure we have the latest statistics and research included, and also the addition of new real world examples and increased opportunities for learners to actually interact with the training through practice simulations, knowledge checks, and call outs with additional resources. We acknowledge that this can sometimes be a sensitive issue to talk about and to train in. And we're so excited that these enhanced training offerings allow additional opportunities to really practice how to have some of these often difficult conversations. We've also included defining and practicing cultural humility and a framework to aid in mitigating bias in care settings that we call the CARES framework. And CARES stands for C is for center before you enter, A is for active listening, R is for respecting the patient, E is for engaging the person in their care, and then S is supporting the person as needed. And this framework aids in guiding patient interactions to prevent from defaulting to stigmatizing stereotypes and biases. And we're excited about it providing examples of strategies, real life strategies and tools and resources that can be utilized as well. In addition to the CARES framework, we've also added new simulations for nursing and medical students that integrate real life case scenarios with debriefing topics and key learning points to engage students in critical thinking, reflective practice, and courageous conversations in a safe learning environment. As I mentioned before, another thing that's an addition, our e-learning module is now worth 1.5 continuing education units. And following live or e-learning training, we now offer some additional add-ons, including during a debrief and action planning session, we facilitate conversations to allow participants to connect experiences and lessons learned in the training to their specific healthcare environments. And our debrief and courageous conversation session, which is another add on, is geared towards educational institutions. And in this facilitated session, students can debrief following the training and engage in deeper conversations surrounding bias and barriers in care settings. And it allows students the opportunity to ask additional questions that may have come up post the training.
So that's really great. Excited to hear about all of those add-ons. And it really is a robust training that not only offers the information and research that healthcare providers need, but goes beyond that to say, now that you know what's happening, here's what you can do and how you can take this to action. So it's really exciting to see all of the enhancements that March of Dimes has added to both the e-learning module as well as the live in-person session. You mentioned briefly, that there is a simulation option for students. And can you share a little bit about how you envision the next generation of healthcare providers benefiting from this implicit bias training?
Yes, what better way to shift the culture and how we can provide equitable healthcare than starting at the very beginning of reaching providers when they're learning how to interact with and treat patients. And in a world where families face the challenges of bias, our implicit bias training serves as a catalyst to galvanize movement along the journey to eliminate maternal and infant healthcare inequities. And we know that this training is not the end all be all solution, but our belief is that everyone is entitled to eliminate maternal and infant healthcare inequities and that they're entitled to the healthcare that they need no matter what their identity is. And we are so proud to inspire others to do the same by starting the process early on in the development of providers to be able to give them the resources they need. So when they start their journey on caring for patients, they already have the tools to provide equitable care without bias. And by directly addressing implicit bias in the healthcare ecosystem, we can shift the paradigms to ensure that every mom and every baby has access to equitable levels of care. So March of Dimes is fully committed to creating a world free of inequities in maternal and infant health care, regardless of social drivers of health. All families should have the opportunity to have the best possible birth experience and start to life. And we're also working to eliminate the stigma from healthcare settings as it can keep people from this best level of care. And women with other, we talk about use of this in against, inequities based on race and ethnicity, but we also realize that women with substance use disorders, infectious diseases, mental health conditions, or other health conditions can often feel judged and blamed by family, friends, and by healthcare providers. And we have developed a toolkit to address stigma in healthcare settings at beyondlabels.org, in addition to this training specifically targeting bias in healthcare settings.
That's great. And I'm so glad you made that point at the end that it is not just racism. There are other types of stigma that we must address in the healthcare system and as healthcare providers. So you also mentioned, Dr. Henderson, that since you started this implicit bias training, that March of Dimes has been able to train 35,000 healthcare providers in 30 states and Washington, D.C. What have you learned from sharing the training? And are there any outcomes or testimonials you can share with us?
Absolutely. So, some participants have reported that the training, for example, allows them to be better tuned to the impact, the negative impact of implicit bias in women's healthcare, to reconsider and to educate residents and fellows and students. Another participant said that it was excellent and engaging. The constant invitation to participate made it very comfortable to speak up. Another said that as a diversity, equity, and inclusion professional, I'm always searching for additional learning opportunities, and I found this training to be well designed, engaging, and easy to digest. Well done. Another said awareness of frequent stereotypes and how this impacts our care of patients is provided in this training, and a need for focus on care of substance use disorder patients. And others said that they feel empowered to know that there's a collective effort towards breaking implicit biases in maternal care and at large. And also, although at times I feel I try my best to be aware of these types of situations, there is always a doubt in my mind that maybe I'm not doing my best. The CARES framework is a very efficient tool to use and practice. And there are many more other similar comments, like learning how biases can affect the way and effectiveness of my clients' interactions, and also learning that stereotypes blind the effectiveness of my counseling, avoiding to have a good rapport with patients. Another said that they really enjoyed the CARES framework and all examples shared with the patient videos, and that they would definitely do some reflection to make sure that they're showing up centered for the community that they serve. And the CARES framework is something that has commonly been commented on. For example, another said that the CARES framework is very detailed and will be extremely useful. I also hope we can implement some of the ideas the trainer gave for ensuring a culture of equity by meeting regularly to continue discussing these matters. One of the things that all of these comments reflect on is that moving from just being aware of the issue of bias in maternity care settings to moving to action. And that's why we, call this training awareness to action. And this CARES framework gives, actionable strategies that providers and others can use to reduce bias in maternity care settings.
Yeah, and I've had the opportunity to view the e-module training, and I can say that those testimonials that you offered really align with the experience I had as I went through the training. And I think that March of Dimes has done a wonderful job of bringing together all of the items that healthcare providers need for awareness and then taking that to action in this iteration of the implicit bias training. And I can also say, from an American Hospital Association perspective, we're really thrilled to have the opportunity to partner with March of Dimes to promote this tool with our hospital and health system leaders across the country. So I just have one last question for you, Dr. Henderson. We know this training is great to build awareness among healthcare providers of implicit bias and what can be done in terms of action. But watching the training is really the first step, right? Much more must be done after that. So, what can hospitals take back with them from this training, and what must they do to continue the momentum on this work?
I'm glad that you brought up that there's more work to do after taking the training. It doesn't stop with completion of the training. But following the training, participants should be able to understand and be able to identify implicit bias, the cognitive bias that informs the bias, and its impact on maternity care settings. They should also be able to explain how structural racism has played a key role in shaping care settings within the United States and how it contributes to the implicit biases that patient and providers encounter. They should also be able to recognize one's potential for implicit bias and apply strategies such as the CARES framework, and to practice cultural humility to effectively mitigate their own implicit biases. And then they should also be able to recognize and establish a culture of equity as an organizational commitment to elevate the quality of maternity care, to fully recognize that to be able to eliminate the inequitable care, that it doesn't just end with the individual, that it requires a change of the culture and a change of systems. And also to continue momentum, we also recommend our debrief sessions that allow for a data-informed planning approach to next steps so that more work can be done within a particular setting after the training is completed. And I also want to offer up, if you want more information, if you want to learn more about awareness to action, how to mitigate implicit bias in maternity care setting, I invite you to visit our webpage at www.marchofdimes.org/implicit bias training.
Thank you so much, Dr. Henderson. And I really do hope that those that are listening will go to that website to learn more about this opportunity for implicit bias training. Thank you for being with us today, Dr. Henderson, and thank you for the work that you are leading at the March of Dimes and for the opportunity to collaborate with you to bring this training to our hospitals and health systems. So thank you again. And to our listeners, we hope you have a great day.
Thank you.
To learn more about March of Dimes implicit bias training, visit www.marchofdimes.org/implicit bias training.